Okay, Manal?
Hello.
Hi.
Thank you.
Okay, our next speaker, Manal Aboelata,
Aboelata.
talking about fostering community solutions for well-being and equity. Thank you very much.
Thank you. Is this on?
Yes.
Okay, great. And can I start at the beginning?
Yes.
Excellent.
I don't know why your preview's not going there.
It's okay. I'll use this. Okay. Good morning, everyone. Good morning. My name is Manal. I'm Managing Director with Prevention Institute, and I'm really glad to be here. Everything that Drew represents is very meaningful to me, and really the namesake of this institution's legacy is, for me, one of the things I take home is using great science to improve the lives of people, and the location of this university, I think, is really significant in terms of this topic, because of the important work that needs to be done yet on this issue of substance use. So it's a pleasure to be here, and I appreciate being invited. As I was listening to the previous speaker, it gave me that feeling of when you have a hammer, everything looks like a nail, because I spend all my time thinking about primary prevention and preventing illness and injury. And one of the big take-home messages that I was hearing from his research was that part of what we need is longer treatment protocols. And if we're going to accomplish that in the current context of our healthcare system, we are going to have to reduce costs, and we're also going to have to prevent some folks from engaging in substance use and substance abuse in the first place if we're going to have more resources for the quality work that needs to be done downstream. So I'm going to be sharing a bit about sort of how I approach and how we approach prevention broadly, and really lay out some of the issues that I'm seeing here, particularly in our work in Los Angeles, about thinking about some future directions for research related to policy and environmental change. And before doing that, we'll just lay out real briefly sort of what I see as some of the real key tenets of community-based research around preventing substance use. These are our LA offices right here in Leimert Park. We just celebrated our 2-year anniversary based in Leimert Park, and today, after this, running up to open to celebrate the organization's 20-year anniversary. So it's a real special day for us doing this work, focused on really being a focal point for the research around prevention, and specifically primary prevention. I do want to say that we have come a long way in the field of primary prevention and community-based prevention, and to give credit for all of you who have been working on substance use and substance misuse prevention, because a lot of what we know about effective prevention comes from the work and the legacy and the effectiveness of comprehensive approaches to tobacco prevention, for example. We have come a long way. We now have new norms in our professional settings and our communities around substance use, and particularly tobacco prevention. And so some of this really provides the evidence for us that effective primary prevention really works. Now, although we do have some last holdouts in our country that don't want to be told what to put on their heads, we know that helmets can prevent traumatic brain injury, and we have a whole lot of evidence from a number of fields, not just substance abuse. Also, when we think about primary prevention and it working in community settings to prevent illness and injury, we can look at the norms change and the research that we've amassed over 20 years, how we've saved lives by involving and invoking new policies and laws to make sure our kids are safe in their cars. And so we take all of this work, which at first seems impossible, like we're pushing a snowball uphill, and then we do a lot of work together as advocates, combined with really great research at the community level, at the policy level, and we can make changes where something that seemed impossible, like getting people to stop smoking, now seems like, oh, we've mostly done that, and now unfortunately have to deal with e-cigarettes. But I think with this issue of substance use and substance abuse, as in other major community health issues, we have also to confront what is our next insurmountable health issue. And I think there are a number of key issues, particularly in substance use and misuse in LA County, but also broadly nationally as people look deeply now at the opioid epidemic as kind of how do we approach this? How do we prevent what's going on? So what I want to do, as I said, is really give a quick overview, read through some topic principles around community-based prevention, spotlight some of the community-based risk and resilience factors related, particularly looking at the neighborhood environments, although I think we can probably safely say we have enough evidence to know that our neighborhood environments are a reflection of a bunch of critical institutional structural factors, including systemic things like how we invest in which communities, structural and institutional racism, trauma, and so on and so forth. I'm going to use environment as a bit of a marker for some of the underlying inequities that people experience and that influence substance use and misuse. And also then I think I want to spend most of my time at the end going over some of the key things that I'm seeing as potential areas, I think probably for rapid research and policy-oriented research to address some of the issues that are really impacting LA County, but I think have implications broader in the state and in the nation. So for me, community-based approaches to substance use really do focus on prevention. They adopt a public health approach, which tells us that we can't only look at the affected individuals, but also need to look at the environment and how sort of the illness and the risk behaviors are engaged in. And then also that we must engage and empower community residents to be involved. And one of the things that I noticed looking at some of the literature is sadly some of the great community-based research literature on alcohol prevention and community-based alcohol prevention really precipitously dropped off around the mid to late 90s. And when I think about what happened there were a lot of political forces at play, including interventions by the alcohol industry who had gotten really wise to what the tobacco advocates were doing. And a lot of that research got really shut down to look at comprehensive approaches. But there's some great studies and meta-studies dating back to 96, which tell us, you know, if we work at multiple levels, we can have a tremendous impact in people's lives and on behaviors. So when we talk about prevention at Prevention Institute, we really focus on a systematic process that reduces the frequency and severity. And that's really important because I think sometimes politically and societally, we accept kind of bad prevention. We accept a little brochure over here, or we expect a sprinkling of a prevention intervention, but we don't often enough demand or receive the kind of resources, if we look at overall healthcare spending dollars, to really do quality prevention. And when we talk about quality prevention, it's really also about looking at health, creating and promoting healthy environments and behaviors. When we talk about prevention, I think it's helpful also to distinguish between primary prevention and other forms of what other people call prevention, taking action after symptoms or risk of illness or injury appear, or after the onset of illness. And so we really focus a lot of our energy and effort on primary prevention, but we recognize that these things are interconnected and need to be dealt with together. Another more plain way of thinking about the prevention continuum is actions we take up front in the thick and in the aftermath. And I think that can be helpful for thinking about just at what point in time are we aiming our interventions to address symptoms and problems. And I do think in terms of the issue, for anyone who's ever had a family member dealing with substance use or misuse, we all know we would much rather prevent that in the first place from ever occurring than having to rebuild lives and so on and so forth. There's a quote here that invokes a public health metaphor, and she says that we're still standing on the bank of the river rescuing people from drowning. And what we need to do more and more, I think, in a number of issues, whether we're talking about in chronic illness or substance use, I think is really take ourselves, our research, our science, our engagement, our investments, and go upstream and do more and more effectively and learn more about what really works at the head of the stream to prevent people from falling in. And that's a metaphor we love in public health. But just to kind of recap on this section of what public health and prevention approach really emphasizes is being aimed at the community environment. So not just the individual who's might be engaged in substance use, but also looking at that contextual factors, neighborhood correlates, and so on. It's also, I think we know, really important that the work is not just aimed at one level, but takes multiple levels of action and engages multiple sectors in action. And also, I think we know from now the work when in prevention, in the field of prevention, where we've seen such a drop for most populations, not all, in tobacco use, in seatbelt use, in child car safety, that when we're really effective, we've really managed to change societal norms, and so that the healthy behavior or the healthy choice is much more the default. And that's really, I think, a function of working at multiple levels of intervention. Now, the second thing I said about effective prevention work is that it really does focus on the environment. And when I say environment, many of us think very quickly about air, water, and soil. And that's very important because our environment plays a key role in health and safety directly. So one of the key fulcrums of tobacco prevention work was about secondhand smoke. It was that whether you smoked or not, you deserved to be breathing clean air. And that was actually a key policy lever to engage a broader public debate around tobacco prevention policy. But the second thing that I think is really important when we look at the neighborhoods where we live, work, play, and pray is that our environment, the places where we exist, where we go to school, they also impact and influence our behavior and our emotional experience that in turn influence our health and safety outcomes. So what do I mean? Environments cue behavior. We don't have drive-through whiskey places in California, but we do have this. We have neighborhoods that are really overburdened with alcohol outlets, for example, that have nothing good to offer the community by way of nutritious food or healthy beverages, but offer plenty by way of unhealthy substances, often in a context where other concerns like lack of economic opportunity, like lack of safe places to play, like low-quality schools, all converge in ways that are really, I think, a setup. And this, I think, is an issue when I talk about some areas for further research. Another example of where our environment is really maybe influencing behavior or cueing behavior and emotional experience of a place that it can influence. And it's not necessarily causal, but we do need to look very seriously that we all do make decisions and make choices in a context, and it's happening for far too many people. So just to kind of cue up, we know that prevention works across a number of issues, but it does have to be quality prevention. But as the IOM said, it is unreasonable to expect that people will change their behavior easily when there are so many forces in the social, cultural, and physical environment that conspire against such change. So many forces in the social and cultural environment that conspire against healthy behaviors. And in this case, we're talking about preventing or reducing substance use. And so the idea, when we want to think about effective research and community-based prevention agenda, we've got to really look at and target the environment in which folks are making decisions and the kinds of things that happen in our political and economic system that give rise to these environments. And what I think is very important when we talk about these social and cultural cues is that we can also change the environment for good and really establish different kinds of norms that promote health and also promote prevention. But I want to really emphasize, and I think the images I just fled through really emphasize that not all communities and community environments are created equally. And this tragically leads to something we call health inequities, which is both a legacy of overt discriminatory actions, but also the implicit bias that our institutions and individuals within those institutions may experience. And we're going to do policy and prevention work. We need to tackle those things head on and recognize that we're all on a journey of unpacking our implicit and explicit biases and how they play out in our neighborhood environments and lead to differences in health outcomes systematically for people, typically people of color and low-income people, urban and rural. And this image, I just want to cue up, I'm not going to go into it, but really reflects that when we talk about the different partners and different policies and procedures that conspire against such change, that there's many factors working like gears, almost in a factory, to literally produce inequities that we see in environments that in turn create those inequities we see in health outcomes. But the good news about this slide is that we can also produce equity by looking systematically at the policies and procedures of institutions and sectors that really shape our community environments. And that's really a key opportunity for prevention. So in moving forward, I think I'm just going to move very quickly at this point, right, to talking about what I think we need now more of. As I said, I think we've lost a little bit of the momentum for robust research looking at the impact of multiple levels of intervention, particularly in substance use. I think we could do more to really fund and support community groups that are doing community-based participatory research and people working at all levels of intervention, and I see that as a critical piece of an effective approach. The other thing that I think we really need to go back to a little bit, maybe the roots of some of the alcohol, tobacco, and drug prevention work that we saw even here in LA County that was really predicated on engaging community residents to define the problems that they see, but also organize, build power, and document the successes of the solutions that were being implemented. And this research really comes out of LMU, I believe, really supporting some of the work that the Community Coalition was doing, evaluation. The other thing I think that's really critical when we think about a community-based research agenda for prevention is we're going through some very dramatic changes in our regulatory frameworks around the location of cannabis dispensaries. And I think that we have to really think very carefully about what's moving forward right now in terms of land use, in terms of now that we're changing and legalizing or decriminalizing, what does that really mean for communities, particularly neighborhoods who have lacked access to maybe the economic benefits and the loaning and the access to capital? And so I think it's a very complicated, but we need to not pretend that racial profiling doesn't exist or disparities in community investment don't exist, and take that on head on as we look at the differences in exposure and concerns we might have about overexposure to cannabis use in cannabis dispensaries in neighborhoods. So I think there's something very important here as the county has embarked on a task force looking at this particular issue. The other thing that I think we need to do more of particularly is look at the intersection between our land use policies and zoning policies and our goals around substance use and drug prevention, because I'm very concerned, and I think Dr. Harawa will be speaking later about some of the impacts of the criminal justice system, and although she'll be talking, I think, more about incarceration, I think we know in LA and other parts of this nation, we have what is often really just seen as an over-criminalization and over-incarceration, particularly of our young men and boys of color, and increasingly young women and girls of color. And land use, I think, may be converging with that in some conspiring in some really impactful ways and creating a real detrimental cycle for our communities and our families. The other thing that I've been really thinking about, thank you so much, is about the need in that looking at multi-level community-based research, the narratives and the messaging and framing. I came to Los Angeles in the late 90s, and it was really apparent to me that there was a narrative, both where I was in Oakland and here, around who are crack users and crack mamas and crack babies and crack heads. And now I'm really struck by the opioid narrative, which is about people who are having diseases of despair. And the whole description of opioid and the opioid epidemic, for me, seems much more humanized than I ever heard the crack epidemic. And I think we need to understand and learn why that is and take the good things about that and really make sure we're applying that equally in issues that disproportionately affect Black and Latino communities. And so I think we need, this slide really talks about individual narratives and lifting out stories of hope and so on, but I think I really wanted to speak to you about what I was seeing in the differentiation as we look at this other opioid epidemic that's really mostly affecting rural and white communities. But I also think another area for research that we need to continue, we saw it being so effective in tobacco and we saw it being effective in alcohol, is looking deeply at who profits and who benefits, and also who disproportionately burdens. And that kind of research, although not clinical, although not sort of individually targeted at a patient, I think it can be very helpful for leveraging and moving policy by really defining where money's flowing from, where it's going, and who benefits and burdens. So I think just in closing, I want to just say, you know, a great quote from one of the women that's in one of our Making Connections for Mental Health Learning community is that when you start with means, you get programs. When you start with strength, you get possibilities. And this is important because in every community, even where we're seeing deep-seated exposure, use, and misuse for drugs and substances, we have people who have immense possibilities to transcend because of their hope, desire for dignity, to live in dignity, and so on. These are some of the emerging pillars of well-being that are coming out of some other work, but it seems to me that they represent also some important fulcrums for understanding prevention, intervention, and support for people who are engaging and dealing with issues of substance use. Prevention Institute is really focused on translating the research and evidence base into practice. So we have a bunch of tools and frameworks and papers on our website, all there for free. One of them, we're working with the substance abuse state substance abuse folks in Ohio to work with them on a framework that we call adverse community experience and resilience, and really looking at multiple community factors in the built environment, social networks, and also institutions, and how they can really be leveraged to reduce community-wide experience of trauma, which we know are related to substance use as a coping mechanism. And we also have another paper that we just wrote, which is on disrupting the pathway, focusing on a prevention approach to medical high utilizers. And the reason I bring that here is because folks who are dealing with multiple comorbidities, often including substance use, depression, and mental health issues, as well as folks that are living with homelessness, are often high utilizers and high cost drivers. So we're really appealing to the healthcare community to engage with other sectors in prevention approaches that can be beneficial, both to people who are struggling in communities and homes and to supporting them in their recovery and treatment, but also to preventing people from going into a cycle of high utilization in the first place. So that is the end of my slide, and I don't know if there's any time for any questions or comments. Thank you so much.
Very powerful talk. Questions? And Shazi, maybe you want a microphone?
Okay.
Thank you so much. I would like to take your talk one notch up and talk about promotion. So the question in my mind is that as a community, as an individual, we all are doing what we have to do in order to avoid substance use and consequences. But what does prevention institute more systematically in order to enhance the education of those who make earlier normal contact with them, in terms of educating policymakers, educating educators, training practitioners, and different institutions that I think are still at the stage of reading that education after them.
I think it's great, and I think the question is not just what does Prevention Institute do, but what is the field doing? I think this issue of educating our legislators is incredibly powerful. We know that they're making decisions every day in specific to substance use, but also to related issues. And I think what I've experienced in my work at Prevention Institute is so often we can be much more powerful when we do that in collaboration and coalition. And so engaging in partnerships, both with others in the field, to really articulate what are the demands, what are the policy levers that we're trying to move. And so we work on a number of different issues at a number of different levels of that spectrum that I showed. But I think it's really important, as you said, if we're going to change norms, getting our decision makers at the local level, at the state level engaged is incredibly important. And I think bringing different pieces of evidence to bear is also really critical because I know, for example, with the cannabis task force example, it's really important to me that the communities of color, for example, are represented in framing the policy landscape and then unintended consequences sometimes of policy decisions from all angles. And so that, I don't know if I directly get at your question, but your point of taking it up a notch is always welcomed.
One more quick question. Here.
Hi, good morning. My question is in regards to the dispensary. Who is regulating? Because it does seem like there's one in every corner. No restrictions to whether the school or any public facility. So my first question is, who's regulating that area? And my second question is, who's educating on our community on what is the right location for a dispensary, or what can we do if there are 3 or 4 in one block?
Yeah, so one is there may be someone in the audience who knows better than I do. First of all, I think they're in a little bit of a historic moment of the wild, wild west in this area, and that we're trying to define that a little bit. And so there is some, I think, so there's the land use planning infrastructure in the city and the county that can have a role in defining. So just as they say, a drug-free zone, and we don't want it within. But I don't know about you, but where I live, you go right down from, school and it'll be right there. And so the regulatory and the enforcement are two related but different things. So there can be regulations that will be, I think, probably developed, and then there needs to be enough resources in the city and county government to basically enforce that